Well, we made it back from ViVE all in one piece, and we landed squarely in the Ides of March. Will I stab Matthew Holt in the back Brutus-Style? Tune in to the March 15th episode of Health Tech Deals. Oh, Matthew Holt. Those ruthless Romans never trust an Italian. That's the lesson here.
Well, sadly enough, I trusted you and you told me to buy some stocks. And now, have you seen the digital health stocks yesterday? Everybody off another 10%. Teladoc
okay,
but
like, how does that compare with like the reality of everything else right now?
I don't know. Somehow, Teladoc was above 300 a year ago, and now it's...
Don't even talk to me about Teladoc.
Now it's around 50. Don't tell me where I bought it.
Before you know it. I'm optimistic. What about that gambling stock? They were actually just on the cover of Bloomberg Business Week. That one
that one you made me buy as well. That's down like that one's only off like 40%.
Yeah,
that's a bargain compared to some of the stabbing in the back.
Matthew Holt, we're weathering this market downturn together, best friends till the end.
Can I remind you the reason I started following your stock picking is you'd weathered the market upturn rather than I had.
Well,
when I was investing in shopping malls during the pandemic.
Actually, the market goes up, the market goes down. Now is the time to buy. I was watching a bunch of analysts who were like, buy, buy, buy. So I'm getting my next round of picks together.
I wish I had some money left to buy with. All right. Well, should we discuss people who have got some money left? Although I am noticing the amount of money is starting to dry up a little. It's not drying up. It's starting to slow down a little bit. And the valuations I'm hearing are starting to trim themselves.
Well, yeah, the valuations are falling apart. That's for damn sure.
We got a lot of going from,
people. We got a lot of dirt at ViVE. I mean,
totally insane to just crazy. All right, you ready?
Set your timer. Yeah. Let's do it. Clarify Health makes a buy Embedded Health. This is Zeke Emanuel's company. Matthew Holt, explain.
Wish I understood. So Clarify has a huge data set, which it gets from DataBank and other data brokers, puts it all together, and then does stuff with it for pharma and providers and health plans. Embedded Healthcare, Zeke Emanuel, legendary, one of the trio of Emanuel brothers he's the medical ethicist at Penn, something to do with behavior change and economics for capitated physicians, and presumably we'll put that into the Clarify stack. How it works, I don't know. How much they paid, I don't know. Not that big a deal as my guess. I don't know much about it before.
There might be an interview with CEO Jean to explain that. Wildflower gets 26 million, brings their total up to 40 million. This is maternity care. Very cool.
Leah Sparks, who, by the way, is one of the founders of Health Tech's Medicaid, been around for a while doing this with some rural Medicaid state plans, improving maternity care support, which is a big deal because it's messed up in this country. She's got a big deal. Providence, which is the big system, is a partner and one of the big players in this, along with TT Capital, and they're going to expand the system to the whole of Providence in California. So hopefully more mums will benefit.
All right, just in time for IBS Appreciation Day, which is a thing, Vivante Health gets $16 million, brings their total up to 40. They're a GI clinic.
This is another big of the GI clinic for IBD and IBS, and all Crohn's and all the stuff. Kim Angelides, who did that Femtech company, founded this, but then left, gave me a nice t-shirt, similar to Oshi, which raised some money recently to do the same sort of thing. So some right. That. Your friends at Seven Wires are the lead here, Robert Garber.
Interesting. All right, Gravie gets 75 million in an E round, brings their total up to 147.
Yeah, this is a big sort of health plan, market-based benefits thing. Huge amount of money, $147 million in total. They have 1,500 total employer clients, only 100,000 lives. So really small, not very many. Doesn't sound like much to me.
All right, nice.
You were in on the wire there.
Nice. I could feel it.
What's nice?
Nice.
Nice.
They get 30 million.
Sorry, you weren't saying the last one was nice. You're saying the next one is nice.
Nice. Nice.
Kim.
Can I please continue?
Please.
Thank you. Nice Healthcare gets 30 million, brings their total up to 36.
All right. I had a chat with Thompson Aderinkomi, who's the CEO here. Interesting. So this is a subscription service, $36 a month, sold to small businesses. So basically, you buy your people a high deductible health plan, with sort of dodgy coverage, but to be nice to them for either $36 a month, which is what, $420 a year in my math, that's correct, maybe
Is that on their website? Step 1, buy a dodgy, high-deductible health plan. Step 2, plug in nice.
Well, I think,
Step 3.
and it's like telehealth, but where telehealth doesn't make it, they send the NPs, nurse practitioners, out to the home to do a whole bunch of stuff. So that's a nice, solution for most people, I think. And this is a bit sold as a discretion to small businesses. They can add on. They're going to go to 20 markets with this money. So he's aiming at this at secondary markets. Incidentally, he did a very similar company backed by the folks at MI Capital who then pulled out, and all the people working with him said, "Oh, you should do this again." So DNA Capital is leading this round. I think it's.
Does this sound like Sprinter to you?
No,
I mean, Sprinter I know has phlebotomists, but they also have clinical nurses. And the point is to extend the telehealth reach and provide some sort of diagnostics. Is this not the same premise?
This is more like Firefly plus a visiting nurse practitioner group than it's comprehensive primary care more than it is like just one thing or another. But you could imagine that Sprinter, which I think I still have got right in my analysis, is
Max Cohen. Let us know.
I need to go back and discuss that video you did last week with Max. What's Max?
Cohen. Yeah.
Max Cohen, the CEO. But anyway, this is more like virtual primary care with a thing going to the home when necessary. And I think some of that is, we'll see, aimed at employees, so not an incredibly sick crowd, but for mums and kids and what have you. I think you'll see a lot of this, right? Because as more people are going to high deductible health plans, it's not that expensive. We're talking less than $500 a year to add this for an employee. And I can see this as being like the way, you kid, but I will save several thousand on your premiums by buying your high deductible health plan, and I will give you primary care for free, essentially. And that's that. I think a lot of if you look at Firefly and whatever Chris Holt comes up with at Marley and Me Health and whatever, and not to mention Teladoc's virtual care platform, a lot of this is going to head down this direction because that's all people need.
This is, and tell me if you got this too, but this was like an undercurrent, to borrow Sarah Holloway's language at ViVE, I thought was like all this conversation about different ways that people are starting to needle in on the payment model. Like playing with different types of, high deductible plans, or like redoing the PBM, or we're taking apart this and we're rebuilding that, or Flume Health building their own health plan through a tech stack. They're powering Firefly. It seems like, correct me if I'm wrong, but I feel like 3-4 years ago, nobody was ever talking about changing the payment model. It was like an immutable truth that could not be bent, other than maybe through value-based care, maybe. And now it feels like people are starting to question it.
So I think the answer is right. Getting the whole system to adopt real value-based care is really tough. But if you can come off at slight slices of it, go after streams which are reasonable. So I don't know whether go back in our list today, right? Or Vivante, which is trying to slice off just GI care, or Wildflower, which is just doing maternity care. That probably has to come from the main system and be pulled down from a health plan. But something like a primary care model.
That's what I'm saying.
You can build a decent business probably if you can get the numbers right and you get the reinsurance right and what have you. But at all in $500 per person per year, most people don't spend that much on primary care. But you get a few who are expensive. It makes your economics go south. So they probably have to get it big enough and get the reinsurance right. But you probably could build a pretty decent business in second tier and semi-rural markets and semi-suburban markets, doing mostly telehealth, which doesn't get used that much and it's very cheap, with home visits when necessary. I think it's probably.
I'm just saying to you, have you ever heard this much chatter about this and seen this many businesses launched this way? Transcarent. You mentioned Rural Health, Jenny Schneider's new company, Homeward. There's a bunch of them that are starting to play with this virtual first model and the payment around it. I feel like that's new. You don't think that's new?
No. I think it's new. It's the slicing off it, right? Can I sell you one bit for a few bucks a month outside of what you're currently paying in premiums? And we're going to see more high deductible health plans. We're going to see more messing around with this within Medicare Advantage as well. It'll be a different flavor, but can you get to the home? Can you do this? Can you do that for the Medicare Advantage plans and in Medicaid as well? So I think, you definitely hit on something.
How nice is that? Look at you.
It's good you've hit on something. Next time, can you hit on a stock quote for me, a stock pick for me that works?
You are so bitter, right?
I'm so poor.
Poor
and bitter.
Listen, listen, man, if you can't weather the losses, don't play the game.
If you can't do the time, don't do the crime. Yeah.
Exactly. If you can't stomach the risk. I mean, I understand you're like 40 years older than me and don't have that much time to make things back up, but still. All right, if you have more age-appropriate stock picks for Matthew Holt, knowing his ability to weather risk or at least market downturns quietly, head on over to Twitter and tweet them over to him. He is at BultyBoy. I am at Jess DaMassa. And to never miss an episode of Health Tech Deals and all the stock picking fun we have here, head on over to thehealthcareblog.com, sign up for the email newsletter, and we will drop these episodes along with the best of the blog into your inbox every week.
I read somebody who was criticizing, I forget, they were criticizing Clover, one of them, and saying, and somebody replied to them saying, shorting is un-American. The last year I've been very patriotic. Very patriotic. I actually, you don't know this about me, but back in 2000,
oh my God.
I was broken-legged and most unemployed for most of 2002, and I made a lot of money shorting the stock market then. Why did I forget?
Hold on, broken-legged and shorting the stock market.
I smashed my knee up and I sat on my ass trading stocks for about 3 months and made some money shorting.
This is like some bizarro Matthew Holt version of like Hitchcock's Rear Window with like Jimmy. I imagine like looking out the window with this binocular.
Except for I was sitting in Park City looking at the ski slopes.
Yeah, and instead of Grace Kelly, you had a computer and you're making stock picks. Awesome. Let's leave this here, yeah? Okay. I agree. All right, guys, we'll be back at you with more deals next time. Take care.